enter the room.
Good afternoon. My name is Dr. Odwakayode Kolafe. I'm one of the doctors in this GP surgery. Could you please tell me your full name and age?
Yeah, sure. I'm Emma Pearson, and I'm 67.
Oh, thank you, Emma. How do you wish I call you for this consultation?
Emma is fine.
Oh, thank you, Emma. Could you please tell me in your own words, just for the sake of confirmation, the reason why you want to see us today?
Well, you see, I've been having these pains in my, mostly in my hip and my shoulders, and it's been there for more than a month now.
Oh, I see. This must be quite challenging for you. If I understand you well, you said this pain started about a month ago. Did it start suddenly or gradually?
I would say it was kind of gradual, and it's kind of worsening over time. Right now, it's kind of bad.
Oh, I see. So this condition has become worsened over time. Is that correct?
That's
Do you know?
correct.
Could you please describe this pain? Is it a dull ache? Is it a pain that comes and goes? Is it what kind of pain? Is it sharping pain?
Well, you see, it's actually pretty bad in the mornings. I have these kind of stiffness in the mornings, and it kind of gets better at when I'm doing something. But I find it very difficult to raise my hands above my shoulders, especially when I have to reach a shelf, a high up, and when I have to stand up, it kind of really hurts. So I find it very difficult to do my work around the house.
Oh, I see. Before this pain started, did you experience any fever, flu-like symptoms?
No, not really.
Okay, okay. What makes this pain better? What makes it worse?
Well, it's really bad in the mornings, but when I'm actually doing stuff, it's actually better at night, once towards the end of the day. But once I sit down, take rest, and if I have to get up again, it kind of starts hurting
Okay, I understand
more.
you well. I understand you. Is this pain located on one side or both sides?
I would say both. Yeah.
Okay, okay, I understand you. Apart from this pain, do you have any other complaints?
Well, not really. Mostly
Okay.
it's just pain.
Any weight loss, any night sweat, any shortness of breath?
No, doctor.
Do you have any history of trauma at all?
Oh, no, doctor.
Okay. Any tummy pain, any vomiting?
No, doctor.
Oh, thank you. I need to ask you some questions about your background state of health. Is that comfortable with
Okay,
you?
sure.
Have you, thank you. Have you been diagnosed of any problem, joint problem before?
No joint problem, but I keep having these heartburns, so I have to take, the gas medication, and I'm on omeprazole, I think.
Okay, you take omeprazole. Do you take any other medications?
No, I don't.
Are you allergic to any food or medication?
No, doctor.
Okay, thank you. And are you currently, when last was your last menstrual period?
Oh, I think I'm not having any menstrual. I think it's been around 17 years.
Okay, okay, thank you. You think this condition is affecting your daily activities, right?
Yes, it is.
Okay, 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 thank you. I want to ask you some lifestyle conditions. Do you
Okay.
smoke? Do you drink alcohol?
Drink I occasionally do, but I like smoking. I smoke like 1 pack a day.
Okay. Do you do exercise at all?
Not really. It's kind of painful, so I prefer not to
What
exert
about your
myself.
diet?
I have a pretty balanced diet, I would say.
Okay, thank you, Emma. I would like to quickly examine you. This will include checking your blood pressure, respiratory rate, oxygen saturation. I also need to carry out some examination like checking your upper and lower limb examination. I also need to look into your tummy and carry out certain investigations.
All right.
Thank you. Based on the results of the investigations that we've done and what we've been able to see, I think you have a case called osteoarthritis.
What is that?
Oh, thank you. It's a medical condition in which the joints become stiffened as a result of recurrent
remaining
between the bones that form the joints.
Okay.
Yes, it is a long-term condition, and as a result of that, you need some management over a period of time. Do you understand?
Oh, okay. All right.
Okay. So what I'm going to do right now, I'm going to discuss with my senior colleague, but we are going to start you with a simple painkiller like paracetamol. Then we are going to involve other professionals in your management because it's a chronic long-term conditions. So I'm going to we are going to invite physiotherapists who will help you with strengthening the muscles of that area.
Okay, that sounds good. That sounds good. All right.
We are also going to help you with occupational health therapy. Where do you live?
I live around the corner with my husband.
I mean, do you live in a flat or in a house? Are all facilities in the same place?
Oh, well, I live in the ground floor. I have a house of my own.
Okay. So the occupational health therapist may need to visit you to see whether there may be changes that may need to be carried out in where you live to make things comfortable for you. Is that okay with you? Then
okay, sure. And what can you give me for the pain, doctor? Like, how will I reduce my pain?
I'm going to give you a painkiller. Then I will also recommend some exercise for you. I will give you a link where you will see some recommended exercise that will strengthen the muscle. I will give you a leaflet where you can read more about it, but I will give you a 2 weeks follow-up appointment to see how you are going. But however, if the condition is worsening or there's loss of movement, you may need to come back to
the next station. Thank you, doctor. Your time is up. All right, your time is up. Hi, Dr. Kim. All right.
Thank you.
All right. So, what made you think this was osteoarthritis?
I wasn't very sure. I remember this condition, but I've forgotten the name. But because I said that when they said the condition is worse in the morning and it's relieved by activities. I remember this orthopedic. I was it's not polymyalgia rheumatica. Is it chronic?
It is polymyalgia rheumatica.
Oh my God! And my mind was telling me, I was just let me just pick something that is common and say, oh God.
But it's all right.
I didn't want to like what happened at the first time, saying something that is that will throw the patient off balance. Oh God.
I know the joint pain cases are very confusing. So we actually came up with a method to understand, what the questions we will ask for certain cases. So when it's the morning pain and it improves with work, it's actually an autoimmune condition. All right. So any of the reactive arthritis, so asking about fever and all is good because those produce antibodies which might attack the the joints, or even rheumatoid arthritis, which is an autoimmune condition, and ankylosing spondylitis. That's also something that improves with work, and also polymyalgia rheumatica, which
But
is
you got that history, right? You got the history that it improves over the day, right?
Yes.
Did you notice that?
Yes, I
Okay.
noticed
Yeah.
that
So
improve.
yeah, that's a
It
very important. Mhm. That's a
it
very
improve.
important clincher.
Okay, okay.
So when you hear that it's improving with activity, it's actually an autoimmune condition. I'll tell you how it happens. So what happens is all these antibodies, when you're at rest, they go and collect on these joints, right? Now when you're working these joints, there is more blood supply. So when there is more blood supply, they circulate more. So then the antibodies are not affecting the joints much.
Mm.
Am I making sense?
You're right. Yeah,
So
you're right.
basically, when you're thinking they improve with activity, think of autoimmune. So osteoarthritis is a mechanical thing, right? Osteoarthritis is wear and tear of joints. So they worsen with activity. And they are
Activities.
also seen elderly. This is an elderly patient for sure. But yeah, and they also affect large joints. So I guess you
Mm.
got confused by the fact that it's large joints and it's elderly. But yeah, they actually become worse with time,
I
osteoarthritis
was
and
thinking that I didn't want to act. I just let me just go with. I need
So
to revise.
I'll just tell you a simple way to identify PMR. So in the first thing is that improves with like over the day, like with activity it improves. That is one thing that basically can be either rheumatoid or PMR. It can be either of these. But then when you come to the examination, they usually give this. This is very typical. That is ability to stand without support and ability to raise hands above shoulders. So these 2 points. So that means only peripheral joints are involved. So peripheral joints are involved only in PMR. Rheumatoid usually affects the knees and hands and things like that.
small joints, the
Mm.
wrist, the hand, the fingers.
So wherever you see peripheral, proximal joints, that is the shoulders and the hip. So difficult standing up is usually
They will
hip.
not be able to do. They will not be able to do like this or take something from the cupboard. They will,
Yes.
Exactly. So that is a proximal joint. So whenever you see proximal joint, think about PMR immediately because that's very in PLAB 2 especially. There's no other case that has this finding where there's proximal joints are involved. So that's very because myasthenia and all doesn't come. So
But osteoarthritis also affects, these proximal joints, but they improve. I
yeah,
mean, they worsen when you
with
work
activity.
more. Yeah, with
Mm,
activity.
mm.
Small joints is, rheumatoid arthritis. So even with rheumatoid arthritis, you have these nodules called Bouchard's and Heberden nodules. Have you heard of them?
yes. I didn't know
Some
this.
of those cases come with the Bouchard nodules and the Heberden nodules, and then there will be morning stiffness, which improves with activity. But right, so this was the case of PMR, but you did manage to get all the data gathering questions right. All right, so let's look at the checklist. All right, so full name, confirmation, patient information you got, that's right. Acknowledge the emotion, Socrates, yes, you managed to do that very well, I would say. Um, Ask about other joints and previous episodes. This is important because you need to understand, is the pain anywhere else? So you need to understand how many joints are involved. And you later on you asked about the unilateral or bilateral. That's also something. Mostly osteoarthritis is also something that is unilateral. Whichever side you're using more, that becomes there's more wear and tear in there. So inquire about symptoms suggestive of myositis, rheumatoid arthritis, SLE, trauma. So a couple of them you needed to rule out. Even SLE is also, you could have asked if you have any rash around anywhere and do you have any muscle weakness. But trauma you asked, so we'll give you a partial for that. So now Another important thing about when you see that the case is PMR, you have to have giant cell arthritis in your mind, right? So even if you're ruling out MR as a differential, just ask a few questions around giant cell, like, do you have any headache, especially on the, side of your head, that which gets worse when you're chewing or combing your hair, because PMR is very much associated with giant cell arthritis. And when you have giant cell arthritis, the one thing that you always have to ask is about the eyes. Any of these case, giant cell arthritis, PMR, make sure you ask about vision, right? Because they can cause acute loss of vision, which can be an emergency. You can have permanent loss of vision in cases of giant cell arthritis. So definitely, if you're thinking PMR or giant cell arthritis, do ask about vision. And impact on work and activity. I did offer this. I'm going to give you a partial on this one. Like you did say, I did say that I find it difficult, like taking things off of shelves and stuff. And all right, explain the suspicion of PMR, I guess. And you could have asked for a couple of blood tests. So a couple of blood tests is required to confirm this diagnosis. So even if you say that I think it might be so and so case, but I need to do some further blood test to confirm it. So even if you think of a certain case, you always have to do the confirmatory tests around it. So in this case, you could have asked for ESR, CRP, rheumatoid factor, ANA, just to rule out the differentials as well as get the diagnosis. So in this case, ESR, CRP will be pretty high, right? So awaiting test results. So even though if you do manage to diagnose this, you have to start them on prednisolone. That is the diagnosis of choice. You have to give them steroids, and that will improve their condition. And so since giving steroids and she already has like heartburns, you understood that she's taking omeprazole for this. So anyway, you need to increase the dose of the omeprazole, since the steroids have an effect to cause gastric ulcers. So yeah, that's something that she needs to take omeprazole. Since she's already on omeprazole, she might have to increase the dose. And lifestyle changes, that is an important factor that you asked me. Do you smoke? I said I do. So in PMR and giant cell arthritis, smoking is something that will aggravate the symptoms. So they have to go in for smoking cessation. So you have to advise them on that lifestyle change. Yeah, this was a lot of, you have a lot of clues in this that you have to pick up and you have to give it management. But yes, so yeah, and every time you're giving steroids, any case where you have to give steroids, you have to tell them about the safety of steroids. Like, I think this case, the management was mainly about managing the case, but it's all right. Sometimes it happens, you get confused. But whenever you're talking about steroids, you have to tell them that you can never suddenly stop steroids. They can have a lot of side effects from that. So that should be tapered. And steroid has these blue cards that you have to carry around. And you have to tell any of the doctors if you're taking steroids that you are on steroids, just to prevent any, interactions with other medications. And yeah, I guess you could have, you did follow up leaflets as well, but safety netting follow up. In this case, safety netting is important because those sudden losses of vision, if you start having headaches, those are related to the condition itself. Yeah. But that's all right. All right. But it's okay. I think you did great. You managed to do very good in data gathering. You asked a lot of good questions, just that you weren't able to come to the right diagnosis. But that happens. Don't worry about it. All right, let's move on.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.